We are 4 weeks out from tax credits on Affordable Care Act premiums expiring unless Congress does something about it before the first of the year. Iowa's News Now State House reporter Skylar Thalal is following the debate as the clock ticks to the end of 2025 and the end of those credits.
Many Iowans looking at health care coverage through the Affordable Care Act are noticing higher premiums for 2026, largely due to the ACA premium tax credits set to expire at the end of the year.
Health economists like myself are most afraid of is that some folks will just decide not to go with coverage at all if it's prohibitively expensive.
This has been a hot button issue in Congress, with Senate Democrats and Republicans striking a deal, voting to reopen the government in exchange for a vote on extending the ACA tax credits. That vote is expected to happen sometime next week.
I would expect that us Republicans would have alternatives to what's being proposed now by the Democrats. I want to make very clear that when there's subsidies that were put in place during the pandemic for income people over 400% of poverty, I'm not for repeating that mistake.
Another idea floating around is giving money directly to patients to help with premium costs, but there aren't any specifics. Some of Iowa's congressional delegation has expressed support for something like that, including Iowa District 1 Rep. Marinette Miller-Meeks. She also says lowering healthcare costs would help with insurance premiums, including PBM reform and more transparency in healthcare-related prices.
I think, broader reforms will take longer. That is not something that's doable by the end of the year, but certainly starting that process, getting everyone engaged. I think it's important that we bring down the cost of healthcare for everyone.
As for immediate action, it's unclear whether or not Congress will make a deal before Iowans have to start paying more for their healthcare coverage at the start of next year. In Des Moines, Skylar Thalal reporting.